Howdy, folks, and welcome back to Healthy Humor. I'm your host, Doc MB. If you haven't had a chance to go like, subscribe, or follow to our podcast, or go look at our website, I highly suggest that you do so. That's the easiest way to stay up to date with any new episodes or article entries, anything like that the podcast or myself, Doc MB, are doing. They're going to be posted on all of our social media platforms and our website as well, with episodes releasing on YouTube, Spotify, and our website. We are working on Apple Music and a few other places where you might be streaming your podcasts. But if you haven't had a chance, go like us, go follow us, subscribe, whatever you want to do to the accounts that we do have open and up right now. Also, as always, please send in submissions for anything that you would like me to cover, or someone that you'd like me to interview even, or a type of provider you'd like me to interview, or specialty within healthcare, anything like that. I really want to make sure that the content for this show is content that you want as listeners and viewers. So please share any feedback. Thank you. All right. Without any further ado, we're going to get into today's episode. We're going to be covering everything you didn't know about HIPAA. So first of all, what is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act. So we hear about HIPAA all the time, right? We mostly hear about HIPAA in regards to its second title, which is all about the privacy of health information, right? I can't tell you that because it's a HIPAA violation, or, oh no, don't share that because that would be a HIPAA violation. We hear it all the time. Most people, even quite a few people who work in healthcare, only know what HIPAA is in regards to privacy and the right to having privacy around your health information. Thing is, that's only Title II of HIPAA. HIPAA has 5 titles associated with the act. So we'll go through those. We'll also quickly, before I get into all of that, we'll go through kind of the 4 primary objectives for HIPAA, which were right to privacy, right? Keeping all health related or health information secure, especially any identifiable information that would connect an individual to their health records. We also saw, what am I saying? One of the other primary objectives for HIPAA was the lack of job lock, which, in regards to this conversation anyway, when we say job lock, what we're talking about is I'm working a job. I was diagnosed with cancer a couple months ago, and I'm going to go try to look for a new employer. Not because my health insurance here is bad, not for anything like that. I just want a new job, but I happen to have a pre-existing condition. In our little scenario here, it's cancer. I'm worried that I'm going to go to my new job and be denied health insurance coverage because I have this pre-existing condition. Well, HIPAA says, nope, you can't do that. You can't deny someone coverage when they come into a new employment situation, new insurance coverage based on a pre-existing condition. So I cannot be denied coverage because of my pre-existing condition. I'm also not going to be forced to pay, extremely high premiums or have a vastly restricted network that I'm allowed to access because of my pre-existing health condition. So that was the second objective, which is preventing that job lock, that feeling like I'm stuck in my job because I don't want to lose my health insurance. So did away with that. HIPAA also had a primary objective of enforcing standards for health information, and specifically standards around that security, right? This is when we get into 2-factor identification, or having, if this is where we're storing our information, it's behind X number of locked doors, right? I think the standard is 2. We don't need to get into that specific today. If you're interested in that, leave us a comment, message on one of the accounts, something. We're not getting into that specific today. It also, going back to the primary objectives here, we also saw a guarantee for the security of that information. Basically saying, if these institutions are HIPAA compliant, then they are meeting these standards. So I keep looking down. It's because I'm looking at my little notes here. Just make sure I'm not telling anyone the wrong thing, right? And also, as always, all of my sources will be included in the show notes. So if you're interested to see, more information about anything I'm talking about, or if you are interested in seeing, I took what I took and how I'm interpreting it, totally up to you. If you're wanting to go down that, or if you're just like, no, Doc MB knows what she's talking about, we're going to trust her. But, I'm taking these documents and I'm interpreting them for you. So, Title I. Title I focused on that lack of denying coverage based on pre-existing conditions, which is great, right? I'm not going to be job locked. I'm not going to be worried that I'm going to lose coverage because I got sick, right? I can't be penalized just because I, got cancer or something of a like, right? Moving forward, Title II, those are your administrative simplifications and securities that were put into place. And this is what we talk about when we talk about not sharing information that would be covered under HIPAA. But who can share your information, right? Are you allowed to share your own information? Is your mom allowed to go talk to your neighbor, her neighbor, whoever, about your health conditions? Yes. Because you and your mom, unless you work in a hospital and your mom's your provider or you're your mom's provider, some variation of that, you're not a covered entity. Your covered entities, if I'm the provider seeing this patient and someone asks me about them, well, I'm a covered entity in that situation. I cannot talk about that patient. The patient can talk about themselves all they want. I can't share their information because I'm a covered entity underneath HIPAA, right? My hospital I work at's a covered entity. Any of the other providers within my hospital are a covered entity, right? And this is specifically to patients that are underneath your care or whatever entity you work for under their care. But if it's not your patient, you're not violating HIPAA if you talk about them. Should you be? No, you definitely shouldn't be. Probably just not a good idea. But in general, we talk about these covered entities versus these non-covered entities as being, an uncovered entity, the individual, your neighbor, your mom, whoever, in that regard, not covered. They're not required to protect your health information. But on the other hand, those covered entities like your primary care physician, your dentist, your psychiatrist, your physical therapist, any of those members of your medical team that are working with you as a patient, they're covered. Those are covered entities. Any of the organizations that they work within, those are covered entities. So that's who is required to keep everything private and secure versus the people who have no restrictions on them. The individuals that have no restrictions on them. So we also have this all within Title II. We have some information about e-data, those electronic health records, things like that. And this is when we really start to, this act came out in 1996, which is a little early for electronic health records, but this second title is what laid the groundwork for that later push for our electronic health records and having everything secured online again. Okay, moving on to Title III. Title III gave us our tax provisions. Essentially, it helped set up medical savings accounts. Before HIPAA, we did have FSAs, which are flexible spending accounts, but we didn't really have these medical savings accounts, medical savings accounts, MSAs yet. They were kind of a provisionary setup, and then with HIPAA, we were able to implement them. Essentially, a medical savings account was not only a savings account that you could access and use on, health-related expenses, but it was also something that could be, accruing interest and be a small way to invest some money for the future. right? It wasn't something that was meant for you to spend all of it. It was, you can put the money in, it's going to accrue interest, you could invest it in things, but you could also use that money to pay for medical expenses, or you could keep it in there if you never had any big medical expenses that you needed to access it for, and then that could, be money that goes towards your retirement, or, mostly just for your retirement, really. That was the purpose of it. It was just another way to put some, pre-tax money into savings. What we did get on top of that, we did get our HSAs. Well, sort of. We were planting the seeds, and then we eventually got our health savings accounts after HIPAA. And if you don't know, so I said we had FSAs before HIPAA, and then we got HSAs with HIPAA, or at least they introduced HSAs, really, or the idea of them. The thing with HSAs, you can roll over all of the money. Any money that you have in a health savings account, if you don't spend it all by the end of the year, it's all going to roll over for you. No limit to how much is going to roll over for you. With your flexible spending account, used to, when they first started, it was use it or lose it by the end of your year. And that was it. There was no grace period, anything like that. We eventually got our grace period of 2.5 months, so January 1, from there you have 2.5 months to go ahead and spend what is left in your FSA, which then it turned into the whole, use it or lose it. But we've gotten some reform now, so that way you have that 2.5 months, but you also have, after that 2.5 months, you can get a little bit of rollover. As of 2025, that number is $660. I think last year it was like 600. Don't quote me on that part, but it is $660 now going forward. So that's money that can roll over even after you hit that, not that initial limit, but that even after that 2.5 months grace period. But, let's say you get to that end of the 2.5 months and you still have $1,000 left, you're only going to get to roll over 660. So that 340 is ghost, right? It's just gone. You don't get it. But it's much better than it was. For anyone out there that's saying, oh, that's not fair, you're losing that money. But that's also the risk you take when you put that money into that account. And it does function a little bit differently. But that's the main difference for it. So moving forward, Title 4 of HIPAA, we get into, this is the application and enforcement of group health insurance requirements. So those requirements that we got to see with the first title, the no job lock because of denying coverage for pre-existing health conditions, things like that. Title 4 just really gets into how we enforce that, right? What it did also bring in for us was COBRA, which, if you've heard of COBRA, that's another one of those acronyms that most people don't know what it stands for. It stands for the Consolidated Omnibus Budget Reconciliation Act. And essentially, if you haven't had to experience COBRA yet, or if you have, most people kind of have a vague idea of what it is, and they definitely don't know what it stands for. They just know it's COBRA. Again, COBRA stands for that Consolidated Omnibus Budget Reconciliation Act. But what COBRA did do is it brought in, some people refer to it as gap insurance, but essentially it's, okay, your employment has ended, but you now have to be offered a continuation of coverage for your health insurance, so you're not just going without health insurance during that time, right? So it allows you to continue coverage even after a qualifying life event like losing your job or losing employment. Moving forward, Title 5, that is our revenue offset title. Basically, it essentially, your employer, let's say that they're offering you life insurance, right? It's not something that you have to pay into. Companies doing it by themselves. Well, if you know how most life insurance works, they're taking that money and they're investing it into something else. That's also how a lot of insurances work in general. You pay those premiums, and those premiums, they can invest that money. So even if they're paying out claims and things like that, that money is still earning for them. This is also how a lot of savings accounts work. But essentially, this revenue offset, this Title V within HIPAA, is saying that if your employer has, life insurance that they put out on their employees, they can't benefit heavily from that, from offering that insurance, right? They can't use it as like a tax deduction at the end of the year, things like that. It's if your employer is still offering you health insurance, or they're paying it out for you, most likely they're just doing that out of the goodness of their heart. Hopefully your company has a heart. But that's how they're doing it. They're not doing it so that they can then use that as a tax deduction at the end of the year. So hopefully if your company is providing you life insurance, that makes you feel a little bit better about it. But who knows? So quick recap here over HIPAA. We had our 5 titles. We don't just have the second title that everyone knows it for, which is a pretty important one. But, besides establishing privacy, HIPAA also gave us, we can have continuation of coverage if we lose our employment. We can have, we're not going to be denied coverage if we have a pre-existing health condition and we're going to a new plan, or a new employer with a new plan. We have, I already said it, that privacy factor. It also gave us the reform on our FSA program, but it also established MSAs and HSAs for us. And then we got our true regulations on what these reforms mean, how they're implemented, things like that. That is all publicly available knowledge and information. And then we also got that revenue offset. So our employers can't benefit from the fact that they provide us health coverage or that they provide us life insurance. So please remember that I am not, all-knowing when it comes to HIPAA. This is based on my knowledge as someone who's done a fair amount of research into this. I teach a decent amount of what I shared with you today in my college courses. If you want to know more, please reach out. If you have any questions that I can't answer, I can certainly help you find the right person or point you in the direction of a great resource. Like I said, I'm not a HIPAA expert, but I do know a lot about HIPAA, and I hope that, my interpretation of the Health Insurance Portability and Accountability Act did help you today. And, I'd love to hear some feedback, whether you felt it did or did not help you, or if there's anything that you'd like more clarification on, just leave a comment. And again, like I said at the beginning of the episode, if you haven't had a chance to follow us on any social media or like our content or subscribe, I really would encourage you to do so, because it's the easiest way to, stay up to date on everything that we are putting out. So I hope that everyone has a happy and healthy day.